Hi, this is Dr. Akhtar Amin and today's topic is conjunctival anatomy and clinical features of conjunctival inflammation. First of all, the anatomy. Conjunctiva, it is a transparent mucous membrane that lines the inner surface of the eyelids, anterior surface of the globe, and it terminates at the corneoscleral limbus. So it lines the inner surface of the eyelids, the anterior surface of the globe, and terminates at the corneoscleral limbus. It is richly vascular. It is supplied by the anterior ciliary and palpebral arteries. Now the parts of conjunctiva. Conjunctiva has bulbar conjunctiva, conjunctival fornix, and palpebral conjunctiva. So first of all, the bulbar conjunctiva. It covers the anterior sclera and it is continuous with the corneal epithelium at the limbus. It is further divided into scleral conjunctiva, above the sclera, and limbal conjunctiva. The palpebral conjunctiva, it starts at the mucocutaneous junction of the lid margin from here and is firmly attached to the posterior tarsal plate. It is further divided into tarsal conjunctiva and orbital conjunctiva. So this is tarsal conjunctiva and this is orbital conjunctiva. And third part of conjunctiva is conjunctival fornix. Now let's discuss one by one. The first one is palpebral conjunctiva. As I already told, it starts at the mucocutaneous junction here of the lid margins and is firmly attached to the posterior tarsal plate. It has tarsal part and orbital part. This tarsal conjunctiva, it is thin, vascular, and firmly adherent to the underlying tarsus, while the orbital conjunctiva, it is loose and it has horizontal folds. And both of these are palpebral conjunctiva. So the palpebral conjunctiva is thick, opaque, highly vascular and adheres to the tarsal plate. Other important structures are transitional zone, which is 2 mm up to a shallow groove called subtarsal sulcus. The marginal conjunctiva, this is the marginal conjunctiva. Marginal conjunctiva is a transitional zone between the skin of the eyelid and the conjunctiva proper. So it is a transitional zone. It starts from intermarginal strips of the eyelid as a continuation of the skin. It is made of stratified epithelium. Marginal conjunctiva continues into the back or posterior surface of the lid for a short distance of 2 mm up to a shallow groove or fold where it merges with the conjunctiva proper. This groove is called subtarsal sulcus or sulcus subtarsalis. Here in this groove, it is a common site for foreign body lodgement. Here perforating branches of the marginal arcade pierce the tarsal plate to supply the conjunctiva. Now the fornicial conjunctiva. Fornicial conjunctiva, it is a fold lining the cul-de-sac formed by the conjunctiva covering the posterior surface of lids to the conjunctiva covering the anterior surface of the globe. Here you can see fornix conjunctiva. The conjunctiva here is comparatively thicker and loosely attached in order to allow free movement of the globe. It is divided into 4 regions. Superior fornix, it lies between the upper lid and the globe. It extends 8 to 10 mm from the upper border of the limbus. Inferior fornix lies between the lower lid and the globe. It extends up to a distance of 8 mm below the lower part of the limbus. A lateral fornix, it lies between the lateral canthus and the globe. It extends for a distance of 15 mm from the lateral part of the limbus. The medial fornix, it is the shallowest and contains the caruncle and the plica similionaris. Now the bulbar conjunctiva, it is the thinnest of all the parts of the conjunctiva, and it is so transparent that underlying white sclera and vessels are seen clearly. It is loosely attached except for a zone of 3 mm near the limbus and near insertion of the recti muscles. Limbal conjunctiva is the part of the bulbar conjunctiva which covers the limbal region and fuses with the corneal epithelium. In limbus conjunctiva, tenons capsule and sclera fuse together. As the conjunctiva in this region is less mobile, a firm hold of the globe can be obtained with the help of forceps at the time of surgery. Now the microscopic structure of the conjunctiva microscopically consists of three layers: adenine layer, fibrous layer, epithelium, adenine layer and fibrous layer. First of all, the conjunctival epithelium. At the junction of the skin of the lids and marginal conjunctiva, which is the mucocutaneous junction, there is keratinized squamous epithelium of the epidermis. It transforms into non-keratinized squamous epithelium of the conjunctiva. Morphology of the conjunctival epithelium varies from region to region. The different regions of the conjunctiva have different epitheliums. In the marginal point, there are 5 layers of non-keratinized stratified squamous epithelium. Superficial layer is squamous cells. The middle 3 layers are polyhedral and the deepest are cylindrical. The tarsal conjunctiva, there are 2 layers of stratified cuboidal epithelium. The fornix and bulbar, there are 3 layers of stratified squamous epithelium. In the limbus, there are 10 layers of stratified squamous epithelium. There are goblet cells throughout the conjunctiva, lying between the cells of the conjunctival epithelium. These cells are actually unicellular glands which secrete mucin. They are believed to arise from the basal layer of the epithelium. They gradually enlarge, become larger as they reach the surface of the conjunctiva. On reaching the surface, they discharge their mucin content and finally shed away. These cells are round and oval in shape and 10 to 20 micrometer in size. These cells are called goblet cells because their shape is goblet-like shape. Next cells are melanocytes. They are primarily seen in the limbus and the fornix, plica similionaris, caruncle, and at sites of perforation of the anterior ciliary vessels. Langerhans cells, they are actually dendritic cells, immune cells that form part of the immune system. Their main function is to process antigen material and present it to the surface of other cells. The next layer is substantia propria or conjunctival submucosa. It consists of a superficial lymphoid layer and a deeper fibrous layer. The conjunctival epithelium rests on connective tissue layer called the substantia propria. This tissue has enormous anti-infectious potential. Numerous mast cells, 6,000 per millimeter cube, lymphocytes, plasma cells, neutrophils. The lymphoid layer consists of many lymphocytes that are scattered to form this fine connective tissue reticulum. The mast cells are granulocyte cells like basophils. Conjunctiva contain a high number of mast cells and substantia propria, about 50 million. Allergic conjunctivitis is a typical mast cell mediated hypersensitivity reaction. The surface of mast cell is coated with IgE antibody, about 50,000 IgE receptor in one mast cell. The fibrous layer contains the vessels and nerves, glands of Kras. In the tarsal part of conjunctiva, it is very thin and blends with tarsal plate. The fibrous layer is thicker than the lymphoid layer. The glands of Krause lie in the deep subconjunctival tissue of the upper and lower fornix, about 42 in number in the upper fornix and 6 to 8 in the lower fornix. Glands of Krause is named after German anatomist Carl Friedrich Theodor Krause. Interestingly, his son Krause's name is associated with end bulbs of Krause. It is a cutaneous receptor found in conjunctiva, lips, tongue, and genitals. Glands of Wolfram and Secasio, they are larger than glands of Krause. Conjunctival sac. The bulbar and palpebral conjunctiva and fornix form a sac in between eyelid and eyeball that opens at the palpebral fissure. It has the capacity to hold fluid up to 30 microliter. The sac already contains about 7 microliter of tear fluid, forming a tear prism. There is about 50 microliter in the per drop. So one drop of eye drop is more than enough for the eye to hold. Now the blood supply of conjunctiva. The arterial supply of the conjunctiva derives from the peripheral tarsal arcades, the marginal tarsal arcades, and the anterior ciliary arteries. Bulbar conjunctiva is the only tissue in the body where constituent blood vessels are visible. So the blood supply is from the palpebral arcade. There are two palpebral arcades which are the major source of the blood supply of the conjunctiva. These are marginal tarsal arcade and peripheral tarsal arcade. Here you can see marginal tarsal arcade and here you can see peripheral tarsal arcades. Marginal and peripheral. The marginal, here you can see the marginal, they are larger than peripheral. There is medial and lateral palpebral arcades of the nasal and lacrimal arteries of the lid supply the eyelid. So lateral palpebral arteries are the branches of lacrimal arteries and medial palpebral arteries are derived separately or together from the main ophthalmic artery or dorsal nasal artery. Superior and inferior branches from these arteries enter the eyelid by piercing orbital septum. The marginal arcade lies in the submuscular plane in front of the tarsal plate 2 mm away from the margin of the eyelid, and the perforating branches pierce the tarsal plate at the sulcus subtarsalis. Lymphatics in the palpebral drained by lymphatics of eyelids. The lateral side of bulbar conjunctiva by preauricular. The medial side of bulbar by submandibular lymph nodes. The nerve supply is from trigeminal nerve. The palpebral conjunctiva is supplied by the maxillary nerve branch and ophthalmic nerve branch, while the bulbar conjunctiva it is supplied by ophthalmic branch.